Segment of the show for today. We're talking to Mr. RWilliams and Mr. Leslie Davis, two members of StreetWorks, an organization that does HIV and AID outreach. And of course, Mr. Davis and Mr. Williams, I think Mr. Davis, we promised you before we had our first commercial break that we'd give you an opportunity to talk about outreach and some of the activities that you're involved in at StreetWorks.
Thank you, Dr. Haney. Yeah, I'm the outreach team leader. What I do is coordinate outreach events. A lot of times, the part of what I do leads into Mr. Williams because we do HIV testing on the street. And we, at StreetWorks, we try to serve the hard-to-reach population, the underserved population. We go into drug use areas, prostitution areas, and we try to reach the people who are most at risk. And we do that with, we give away condoms and information about our programs, as well as we try to get people to do the HIV test. We have a big mobile unit that we go and do those type of things. We also participate in health fairs. We coordinated ourselves, the whole agency, a fall festival in September where we invited different agencies from around town to come out and do several different types of screenings. We were diabetes, blood pressure, from different agencies around the city, and we brought them to the areas in which we serve the people in the South Nashville area. So in doing that, we reach a wide population, a variety of people. You know, we try to, we do a lot in the African American community. We have had some inroads with the Hispanic community, but a lot of it is in the African American community. And StreetWorks, basically, we are the best at that particular, in that population and doing what we do as far as street outreach and outreach period. I
understand, and of course I think that people often explain it that it's a real problem. This HIV, AIDS is in terms of numbers among African Americans. Is that why don't you say something about that in terms of how critical it is in reference to this population?
Exactly. Close to half, 45 to 50% of the persons who are infected with HIV are African American, and the number of African American women is much higher than anybody else in the nation at the moment. So that is a real problem. I think that the lack of education, a lot of miseducation, a lot of myths are still floating around, even though I've been doing this work 10 years, and I know you've been doing several shows over the years concerning this, Mr. Crowder. Everybody, the education is out there. I think that we still have a real big stigma. I think especially in the South about HIV, AIDS, persons who are living with HIV and AIDS. I think that it's important for us to dispel the myths and dispense facts concerning HIV and AIDS, how you get it, how you don't get it. And at this point, a lot of people still believe that it's a death sentence if you do get it. They don't want to talk about it. People who think they're not infected shun people who are infected. So people who are infected don't want to seek help, don't want to go to the doctor. They don't want to socialize, and they don't want to tell people who they may come in contact and could possibly infect that they are HIV positive. And I think that is a big problem as far as, and especially in the African American community, the stigma. I think that we definitely have to get over that and embrace those of us whom have the virus in order to make them comfortable about talking about
what they have.
Exactly, educating other people, so we can keep our whole community safe. You see.
And Ms. Williams, in terms of early intervention, what are some of the things that you find to be very, very important in terms of dealing with this disease?
I'm going to piggyback on Mr. Davis, and I'm going to say the stigma is one of the largest issues that we have. Me coming from a college education background, we never even discussed this in any of my classes, that once you have came in contact with this, people look at you like you are nothing anymore. That's why people are so harsh, and they don't want to disclose the fact that, yes, now that I have this disease, I got to keep to myself. I got to go in the shell, and now that I can't be in society like I was or once was. They think life is over. As it may seem at that time, it isn't. And so, as my job, one of my jobs is to instill in them the hope that it's not, life is not over. And then to also let them know that with the medical advances, the things that have came a long way from when the 80s, when HIV and AIDS were first introduced, until now, we have over 20-something drugs that people can take. And the drugs are designed to make them live a substantially longer life. And so if they do the right things, eat properly, and take care of themselves as a normal person would, then they can live a productive life, and they can have productive relationships. But once they come in contact with HIV, they feel like, I can never have an intimate relationship again, because I'm not going to tell somebody that I have HIV or AIDS, because they're not going to want to talk to me. And it's the ignorance.
You know, one of the things that I'm curious about, what about the spirituality of some of these individuals? Does that ever come into play, the very, very fact of the spirit, them being spiritual beings and et cetera? Is that simply absent in terms of any kind of discussions that you have with them, or what?
I kind of feel out the situation. When I'm talking to a client, I can tell if they have any kind of spirituality, as far as most of the clients, when they first get diagnosed, they're like, I'm not going to believe it because I got my faith, and my faith is this, and this is it. And so I can go on that and say, well, you know, you took a chance, you got risky behaviors, you did this, and now you have to take the responsibility for it. And so I can give them the information that I have and tell them that, of course, if you're spiritual and you believe in this God or that God, your God will bring you out. And with that being said, don't lose your hope. Just don't lose your hope.
And as you've worked in we've got about a minute, Mr. Davis, and you've worked in this area for a number of years, and so you think that the stigma is still, as well as you, both of you think that it's the whole stigma thing that keeps us from being able to really deal with this as an issue.
Yeah, I think stigma definitely perpetuates the disease. It keeps us behind as far as in knowledge and even actions, because people do not act as they probably should, or in a healthy manner, when they are faced with the stigma and faced with, you know, living life with this virus. So stigma is playing a big part. And, you know, miseducation, undereducation, that type of thing has a lot to do with it. But I think that if people were more open to talking about it and having these kind of discussions, we can move forward.
And of course, we're going to be back with our audience following this very, very short commercial break.